Now, in our fifth and final section of the lecture, laryngeal paralysis and trauma, we discussed in detail all the causes of laryngeal paralysis, unilateral, bilateral, involvement of superior laryngeal nerve, involvement of recurrent laryngeal nerve, and then we also talked about the involvement of combined both superior and recurrent laryngeal nerve. But in this section now we will discuss the causes, what are the different traumas that can lead to the laryngeal paralysis or involvement. Etiology and pathology of laryngeal trauma, diagnostic evaluation of trauma, and also the conservative and surgical treatment of laryngeal trauma. Etiology can be, larynx can be involved in different traumatic accidents, and even some procedures can also be associated with laryngeal trauma. But here the most common is automobile accidents. Any roadside accidents can lead to the laryngeal trauma. Blow or kick on the neck during the fight can cause the laryngeal trauma. Neck striking against wire or cable, strangulation, penetrating injuries with sharp instruments or gunshot. So all these are very common cause of laryngeal trauma. Automobile accidents, gunshot wounds, even the injuries by any sharp instruments, knives, strangulation by wires or by sharp threads also. Nowadays they make the sharp threads that can cause the strangulation and cause the laryngeal trauma. Pathology is degree and severity of damage varies. Again, depending on the cause of the trauma and how bad is the trauma, the severity of the symptoms or severity of the damage, it is variable. Hematoma and edema of supraglottic or subglottic region. So hematoma and edema, swelling and hematoma of supraglottic or subglottic region. Tears in laryngeal or pharyngeal mucosa, and these tears can be from different causes, different traumas or different injuries. These can occur. Dislocation of cricoarytenoid joints, dislocation of cricothyroid joint, fracture of hyoid bone and upper tracheal rings, fracture of thyroid and cricoid cartilage, and trachea may separate from cricoid cartilage. So again, different severities can occur, different degree of severity is present depending on the trauma that can occur, and leading from hematoma and edema to tears in larynx and pharyngeal mucosa. Then we can have total dislocation of cricoarytenoid joints, cricothyroid joints, fractures of the bone and tracheal rings, and also fracture of thyroid and cricoid cartilage. Clinical features are respiratory distress, again depending on the severity of involvement. There can be respiratory distress because sudden hematoma and edema can put the pressure and cause respiratory distress. If it's severe, urgent tracheostomy may be required to stabilize the patient. Hoarseness of voice or aphonia, painful and difficult swallowing, local pain in the larynx and hemoptysis, or blood in the sputum. So all that is possible in the laryngeal trauma. External signs now are bruises or abrasions over the skin. Bruises and abrasions are very common after the trauma. Palpation of laryngeal area is painful. Subcutaneous emphysema as a result of injury, there is emphysema. Flattening of thyroid prominence. Fracture displacement of thyroid or cricoid cartilage. Displacement of hyoid bone. Onychrapitis elicited. Cricoid, because of the entry of the air, sometimes there is crepitus. Cricoid cartilage separation from larynx to trachea. So these are some external signs associated with the laryngeal trauma. Diagnostic evaluation. Indirect laryngoscopy reveals location and degree of edema and hematoma. Mucosal laceration, posterior displacement of epiglottis, exposed fragment of cartilage, asymmetry of glottis or laryngeal inlet. Direct laryngoscopy is precipitate the respiratory distress, necessitate immediate tracheostomy. Fiber optic laryngoscopy, improve visualization. Fiber optic, if there is replaced, it can replace direct laryngoscopy, fiber optic laryngoscopy. So these are some tests that can be used for evaluation of the extent of the trauma and the injury, which can be indirect laryngoscopy and direct laryngoscopy, direct examination of the larynx, which is performed under the general anesthesia. But even indirect laryngoscopy is helpful in finding out the edema and hematoma, any laceration present, any displacement of the epiglottis that is present. X-rays also can be performed, which shows soft tissue lateral film of neck is useful, reveals subcutaneous emphysema, swelling of laryngeal mucosa, displacement of epiglottis, fracture displacement of hyoid bone, thyroid and cricoid, and change in the configuration of air column. So these are also, X-rays is a very simple basic test, but it can reveal so many different causes or so many different effects of the injury that can be possibly present, like displacement of epiglottis, swelling of laryngeal mucosa, subcutaneous emphysema. These can all be present. CT scan, assessment of moderately severe injuries of larynx. Associated injuries are examination of injuries to head, cervical spine, X-ray chest for pneumothorax, and gastrographin swallow for esophageal tears. So CT scan is also for moderately severe injuries and severe injuries of the larynx we can use. 3D CT is more useful in laryngeal trauma. Conservative treatment is the hospitalization and observation, voiced rest, humidification of inspired air, antibiotics course, and steroid therapy. These are all conservative treatment to relieve the symptoms associated with the trauma. Surgical treatment is tracheostomy, very again depending on how bad is the airway obstruction or respiratory distress, tracheostomy is performed. Endotracheal intubation is difficult, tracheostomy preferred in such cases. Open reduction, wiring of fractures, repairment of mucosal laceration, anchorage of epiglottis in normal position, end-to-end anastomosis, repositioning of arytenoid cartilages, internal splintage. So all these are different open reduction procedures that can be performed for the trauma of the larynx. Webbing of anterior commissure, which is silastic keel. Complications are laryngeal stenosis, perichondritis, laryngeal abscess, and vocal cord paralysis. So these are the complications associated with trauma. That concludes our today's lecture, which is the paralysis of the larynx and trauma, and we talked in detail about both these conditions. Thank you for watching sqadia.com.